Hello and welcome everyone to another Central Drugs Compounding Pharmacy um, webinar. We appreciate you tuning in. This is a webinar put together by one of our interns, Nicole Chow, on bone and joint health. Nicole is from Ohio Northern University College of Pharmacy, and she's been on rotation here at Central Drugs just for a couple of weeks. And we've really appreciated her help around the pharmacy. She's been working with our pharmacists, and she's been working in our labs, and it's just great to have people like Nicole come in and be a part of Central Drugs. So, Nicole, just as a way of introduction, could you just tell us a couple of things about yourself?
Um, Hi everyone. I grew up in California. I went to Ohio for College of Pharmacy, and I'm currently doing my first rotation at Central Drugs, which is really exciting, and I really look forward to learning more things in the pharmacy.
Yeah, and you're about a year away from graduating and going off and being a pharmacist all on your own.
Yeah, it's really exciting.
Yeah, very good. Well, thanks for being here and thanks for putting this presentation together. So, um, let's get into why this is important for our patients to know about.
Okay. So, bone and joint conditions account for over 130 million physician visits annually, and about 780,000 joint replacement procedures were performed in the US in 2006. 40% of women over the age of 50 will suffer at least one osteoporotic fracture in their lifetime. So, this is a serious topic for improvement of patients' overall quality of life.
Now, you mentioned women here, 40% of women over the age of 50. Is there more of a likelihood that women will suffer bone fractures or bone problems as they age than men?
Yes, actually, women is more at risk for suffering bone fractures, especially postmenopausal women.
Okay,
Yeah,
okay. It's good for our people to know.
yeah. So first, we're going to discuss about bone. Um, so just general introduction regarding bone functions will help us understand the importance of bone. So bones provide a framework for the attachment of muscles and other tissues. Nearly all bones provide support for muscles. Many other soft organs are directly or indirectly supported by nearby bones. Bones such as skull and rib cage protects internal organs from injury, and it enables body movements by acting as levers and points of attachment for muscles. Bones serve as a reservoir for calcium and phosphorus, which are essential minerals for various cellular activities throughout the body. And the production of blood cells occur in the red marrow found within the cavities of certain bones.
So, Nicole, those first 3 points, usually when I think of my bone structure and my skeleton and what the purpose of it, those first 3 points are usually pretty easy to think about, that it provides support and protection and helps me move. But those last 2 points, mineral storage and blood cell production, that's not something that I would have regularly thought of as far as what the bone does. I didn't know that bones actually produce blood cells.
Yeah, so exactly. So a lot of us don't really understand the whole function of bones. So it's really important for us to know these, and then because of that, we will know the importance of bones and then better take care of it.
Yeah, and with the mineral storage and the blood cell production, that's why it's so important to be thinking about what we eat and the supplements that we take that will provide for healthier bones so that they can do, especially these two functions, better.
Yeah, exactly. I agree with you. Yeah. So we'll talk more about that later too. Um, So, how do we know if our bones are in a healthy condition? We do the bone mineral density test called the DEXA scan. DEXA scan is a machine that produces X ray beams and helps to measure the thickness of bone based on the amount of X rays that pass through the bone. This procedure is painless and it's non invasive. So, who should get the bone density test? It's recommended for women over the age of 65 and men over the age of 70. Also, postmenopausal women with risk factors such as previous fracture, history of smoking or alcohol, family history of osteoporosis, taking corticosteroid, and eating disorders.
So there's an easy test that people can ask their physician about.
Yes.
Okay.
And so DEXA scan can help us judge the bone density. In this case, the osteoporotic bone is a lot more porous and fragile, which can lead to more fractures and fall risk. So DEXA scans should be repeated every year after the diagnosis of osteoporosis. A common bone disorder is osteoporosis, which was seen earlier in the picture. It's characterized by low bone mass and deterioration of bone tissue. It is often called a silent disease. You can't feel or see your bones getting thinner. Many people do not even know they have thin bones until one of them breaks. And osteoporotic patients are at increased risk for bone fractures because the bones are very porous and it does not provide a good protection during falls or incidents. A broken bone can interfere with your daily activities and can have serious consequences, such as being confined to bed or a wheelchair. People with osteoporosis most often break bones in the hip, the spine, and wrist.
And we probably all know people who have had that kind of an injury, whether if you're in the north, if you've slipped on ice or slipped on some stairs or something like that, where your mother, your grandmother, your whomever you might know has had that kind of an injury. And we're going to talk about some ways to help minimize that risk.
So, just some risk factors of who might be more prone to getting osteoporosis. Again, it's being a female gender, postmenopausal women, older adults, small body frame, low calcium intake, and being physically inactive. So here are some ways to build healthy bones. Like muscle, bone is a living tissue that responds to exercise by becoming stronger. Young adults who exercise regularly generally achieve higher bone density and strength than those who do not. For most people, bone mass peaks around their 30s. After that time, they can begin to lose some bone density. So it is important to do weight-bearing exercise to help build bones and keep them strong. Walking, hiking, and weightlifting are good examples of weight-bearing exercise. It is recommended to do 30 minutes of exercise each session and repeat 2 to 3 times per week. Caffeine-containing beverage consumption such as soda and coffee has been reported to be associated with reduced bone mass and increased fracture risk in some studies. 2 to 3 ounces of alcohol intake can decrease the absorption of calcium, which is important for bone health. Alcohol also affects the liver, which is important for activating vitamin D, and vitamin D is important for calcium absorption.
So you said even people in their 30s begin to lose bone mass naturally. Did I hear you say that correct?
Yes, yes.
Wow. So, okay. So even in your 30s, you've got to start thinking about these things.
Yeah. And so also diets rich in calcium such as milk, cheese, broccoli, and yogurt will also be additional calcium resources.
Now, I've read that broccoli, some of those really dark green vegetables, are great sources of calcium, and I would not have known that either.
Yeah.
But that that may be even a better source of calcium than some of the dairy products if you've got a digestive system that doesn't like dairy.
Yeah, exactly. Yeah. And then there are also some diet rich in vitamin D to help absorb calcium, such as salmon, cod liver oil, and tuna. So getting enough sun exposure can also help supplement vitamin D in our body.
Very good. And calcium and vitamin D, they work together?
Vitamin D will help enhance the absorption of calcium. So it's very important that we have both enough vitamin D and calcium.
Because if your body can't absorb the calcium, that does no good. It just goes away. Okay.
Exactly. So calcium supplements can help strengthen teeth and promote bone health. Calcium is needed to have stronger bones. So there are different salt forms available on the market for supplements. Calcium citrate is better absorbed on empty stomach. It is less dependent on stomach acid for absorption. So older adults often have decreased stomach acid, so this citrate form may be a better choice than calcium carbonate. And calcium carbonate should be taken with meals because it requires stomach acid to dissolve and absorb. So calcium supplements are generally well tolerated, but some patients may experience some constipation or abdominal irritation when taking the supplement.
And vitamin D might actually help some of that constipation problems. Is that right?
Yes, yeah, it can
Sometimes?
help. Yeah, and then taking with food sometimes can help with abdominal irritations too. So there are different daily calcium intake recommendations for different age groups. For adult, it is around 1,000 milligrams daily. Elderly and females might require a little more than 1,000 milligrams daily. Also, the maximum a person can absorb at a time is about 500 milligrams. So a person who needs 1,000 milligrams of calcium from supplements should split the dose into 2 times a day rather than taking it all at once.
Good.
Next is our vitamin D supplement. Vitamin D helps to stimulate the absorption of calcium from the gut, so it is also very important to supplement on vitamin D. As shown in the slide, we have specifically vitamin D3 in the picture, which is shown to be more potent and has longer shelf life than vitamin D2. Vitamin D is generally well tolerated and not much side effects will usually be observed.
And as a bonus, vitamin D is crucial to boosting your immune system.
Yes. And the daily vitamin D recommended amount is different in different age groups. Again, patients 1 through 70 years old is recommended to take 600 international units daily, and individuals over 71 years old recommended to take 800.
It's good information to have.
So, a lot of the calcium supplements will have added vitamin D to help enhance calcium absorption, like the Bone Builder and Dynacal, which is a great way to reduce pill burden. Also, Pan has calcium, vitamin D, and magnesium. Magnesium is required for energy production and also contributes to bone structural development.
And if you're looking for a place to get these supplements, I mean, you can find them all over the web. You can go to lots of different places to find these kinds of supplements. We sell them here at our pharmacy, and you can. We actually have an online store. If you wanted to buy them online, you can do that right from your own home. So check it out.
Strontium is another element found in the bones. It can be used as a second line supplement agent because not a lot of studies have been conducted, but some studies have shown that strontium can increase bone mineral density and prevent bone loss. And also, no significant side effects of strontium were reported, but some patient might experience stomach upset, but it's rare. So next, we're going to discuss about joints. Joints occur where two bones meet. They make the skeleton flexible, allowing a rigid skeleton to move. It also secures bones together. As seen in the diagram, the synovial fluid provides a slippery, weight-bearing film that reduces friction. Also provides nourishment to the cartilage.
Boy, I sure feel sorry for the people who have joint problems because that can be really painful. I think as your next slide is going to point out.
Yeah. So with the overuse or injury, cartilage on the end of the joints can break down, causing a narrowing of joint space and bones to rub together. Painful bony growths or spurs may form. This can lead to swelling, stiffness, and possibly osteoarthritis, which is the most common type of arthritis.
Oh, so painful.
So, this is not an inclusive list of disorders, but just some of the more common joint disorders. One of the joint disorders is osteoarthritis. Patients with OA will experience aching pain, joint stiffness, and crepitus, which is the crackling sound heard with joint movement. Another type of arthritis is rheumatoid arthritis. It is an autoimmune disease characterized by extreme inflammation, swelling, and painful joints. Bursitis is inflammation resulting from excessive stress on the bursa, which is a small fluid-filled sac that acts as a cushion between bones and other moving parts.
Are there differences in the symptoms of these three different diagnoses, or are they all the symptoms can be kind of the same? A lot of pain, probably.
Okay, so within these three, there are a lot commonalities, but also some differences. For example, the rheumatoid arthritis patients will often experience inflammation and swelling.
Okay.
So that's something a little different from osteoarthritis.
Mm.
But then again, a lot of them will have common symptoms of pain and difficult movement and stiff joints.
Okay.
So, what are some ways to improve our joint health? Losing just a few pounds will help to take some strain off your hips, knees, and back. Extra pounds increase the load placed on these joints, increasing the risk of cartilage breakdown. Even a little weight loss can help. Every pound you lose takes 4 pounds of pressure off the knees.
Wow.
Yeah, and many arthritis experts believe that stretching is an important type of exercise. Try to stretch daily, but at least 3 times a week. However, it is really important that you don't stretch whole muscles. Do a light warm up before stretching to loosen up the joints, ligaments, and tendons around them. Low impact exercise like walking, bicycling, and swimming are good choices. High impact exercise may increase the risk of joint injuries. So, should avoid rapid and repetitive motions of affected areas of joint. If you already have arthritis, first speak with your doctor about choosing the most appropriate exercising plan. And stronger abs and back muscles help with balance. The more balanced you are, the less likely you are to damage your joints with falls or other injuries. Good posture, such as standing and sitting up straight, protects joints all the way from the neck down to your knees because there will be no weight emphasis on specific joint if weight is distributed equally on all body parts.
Very good. So exercise is really important, and finding the right kind of exercise, low impact exercise, is also important, especially as you age. Um, there's, there's lots of resources out there to learn about exercise, and of course, ask your doctor what they recommend.
Yeah. Yes. And so some supplements can be utilized to help with joint health. Glucosamine sulfate is a chemical compound found in the fluid around joints. Glucosamine can improve pain and movement in knees affected by osteoarthritis and strengthen the cartilage. It is believed to help develop and renew cartilage and keep it lubricated for better joint movement and flexibility. Um, Chondroitin is often added to the supplement, which will help promote water retention and elasticity to inhibit the enzymes that break down the cartilage in the joint. And again, this supplement is likely safe when used appropriately by adults, and not many side effects have been reported for these. Next, we have MSM. It's a naturally occurring form of sulfur that helps support muscle and tendons in the body. Many patients use it to supplement for pain and swelling of the joints, and this supplement is also safe.
So we should make you say the full name of the supplement, right? I mean, MSM. We'll all remember MSM, but what's the full name?
The full name is methylsulfonomethane, but it's easier to say MSM.
Yeah, I just wanted to challenge you on that.
Okay, so next we have the hyaluronic acid. So as our joints age, hyaluronic acid is the fluid that protects the lubrication between joints and connective tissue, and this will begin to break down. So hyaluronic acid is a large polysaccharide found in connective tissue, and it forms a large bulky molecular chains that will help joints to move smoothly and provides a cushion between the joints. Over time, this fluid begins to lose its bulkiness and often leaks from the joint with the resulting friction causing discomfort. So this supplement may be a useful dietary supplement for individuals wishing to support healthy joint function.
So am I right in thinking about hyaluronic acid as sort of like the ball bearings in the joints that kind of help? Well, you said it helps reduce friction and helps joints move together smoothly. So this is really important to have that in there.
Yes.
Yeah. Okay. It's like liquid ball bearings almost.
Yeah.
Oh, okay. Very good.
And next we have turmeric. It helps to reduce inflammation and ease symptoms of osteoarthritis and rheumatoid arthritis. Turmeric also has antioxidant effects to help decrease the free radicals responsible for painful joint inflammation. Next, we have Wolbenzyme that helps to support joint health. It will alleviate aches and pains, improve mobility and flexibility, and also help body recover faster after strenuous physical activities. And not many side effects have been reported for these as well.
And we've had Wobenzyme in a couple of our other webinars as well. That's come up. It has a lot of benefits.
Okay. And lastly, we also have proteozyme. It is another useful nutritional adjunct for individuals who wish to supplement their diets to provide nutritional support after injuries. So this one will contain a lot of supplements within it, not just glucosamine or bovine and papain, but it has a lot of other supplements in there.
It's kind of an all-in-one.
Yeah.
And you said it's mostly useful for injuries and healing? Is that? Did I hear you right?
It's a useful nutritional adjunct because it
Okay.
has a lot of nutritious supplements in it.
Okay, very good.
So, in summary, it is important for us to eat healthy and have diets rich in calcium, vitamin D, such as soy milk, fish, and then broccoli, dark leafy vegetables. And decreasing alcohol intake and smoking cessation will lessen the stressor on our body. Low impact exercise will help strengthen our bones and joints. And finally, it is important to utilize supplements to maximize our bone and joint health.
And you'll notice, and we say this in just about every webinar we do about health, that we are big proponents of getting your nutrients from your food first. That's why in Nicole's slide here, diet is the first bullet point, where you've got to be eating your dark leafy vegetables, broccoli, getting your calcium from those vegetables as much as possible, and making sure that you're eating foods that add to your health and not subtract from your health. And then after that, everybody is different and everybody's nutrient levels need different examination. That's why we have supplements, because really our food chain has been damaged by so many years of um, lots of different things. Big food companies doing things. We won't get into that, but that's where supplements come in. Is where your food diet can't provide the optimum levels of those nutrients. That's why supplements exist, and that's why we provide those. But diet first. Make sure that you're eating the right foods first, and limiting your risk by reducing your alcohol intake. Stop smoking. Make sure that you're exercising. All of those things come first, and then we can talk about supplements and how you get your nutrients from those supplements. Well, thank you, Nicole, and if you want to learn more about bone and joint health, we provided some more information on our website. You can go to www.centraldrugsrx.com/bone joint. One word. centraldrugsrx.com/bone joint. And there'll be some information here that a lot of the information that Nicole provided today, and possibly even sort of a downloadable cheat sheet that you want to maybe put on your fridge if you want to, and just to remind you of some of the things that you can be doing to improve the health of your bones and joints. So thank you very much, Nicole, for putting this together. We really appreciate it. And for anybody who's interested in learning more about your health, we've got other videos and more webinars on our website. Go to centraldrugsrx.com. You can also find us on Facebook or Twitter. We're pretty active in those social media platforms. When you go to our website, you can sign up for our patient e-newsletter as well. And that's where you'll get nutrition news, health news right in your email inbox. We'll tell you about upcoming seminars, upcoming webinars, and you'll be up to date on the latest health research as well. And if all else fails, of course, you can always call us at the pharmacy, 877-447-7077. We've got pharmacists who would love to talk to you. We've got a nutritionist here on staff that talks with people and works with them about improving their nutrition and their overall health as well. So give us a call, visit our website, join our newsletter list, find us on social media, do all of those things. We would just love to interact with you. All right. Thanks again, Nicole, for putting this together. We really appreciate it.
All right. Thank you, Mark.
All right.
All right.
Bye, everyone.
Bye.